Hello and welcome back. Well, we are now at domain number 4. And domain number 4 actually is like almost 30%. It's like 29.1%. So, first, I want you to notice that this is about compliance and, in particular, regulatory compliance. If you don't know by now, healthcare is a highly regulated industry. And when I look at these 6 tasks that you are expected to be able to perform on the CCS exam, I think it's important that there's a couple of things that I do a call to action. And I'm not going to go in the order because I want to be very intentional about a few things. Number 1, task number 6 says apply the Uniform Hospital Discharge Data Set. You probably have seen that if you've read the guidelines. You've seen the UHDDS. You've seen the word because principal diagnoses, right? So here, what you need to understand is that this is the data that is collected from the time the patient is admitted to the time that the patient is discharged, and it's that data that's being populated onto the claim form. Oh, what claim form is that? The UB04 claim form, also known as the CMS 1450. It's important that you recognize all of the elements of UHDDS and then who collects that data. And you probably are wondering, well, why do I need to know all of that? You cannot be a professional who is one-dimensional in your thinking. As coders, we work with a variety of departments. And there are several departments that are involved in collecting this data. And when the CFO says, hey, why have these patients been discharged from the hospital, but the claim hasn't dropped? You need to understand the front, the middle, and the back of the revenue cycle because you will need to collaborate with those professionals. Now, I know you're like, Dr. Campbell, what are you talking about? Okay, I want you to think about this. Let's say somebody goes to the emergency room. They have to get registered, right? Who registers the patient? Patient access specialist. That patient access specialist is going to collect that demographic information. All of this information from the time the patient comes to the time they leave is a part of the data that we're collecting. As we wrap up this 4th domain, I want you to understand that coding is a profession. And it is a profession that requires you to have a mindset, coder mindset, growth mindset. A lot of people go to school for medical billing and coding. Number 1, coding is different than billing. And they're different because why? You got to code before you can bill. So understanding that data set, how the information then makes it onto the claim form, I would recommend you get a copy of the UB04 claim form and just see the different data that goes in the form locators. And you'll see which part you collect and which part is collected by other professionals along the revenue cycle, front, middle, back. Adherence to HIPAA standards of ethical coding. Find these on the internet and read them. And you know what I'm going to say? What am I going to say, right? I'm going to say, read them 3 times. You already know the deal. Ensure compliance with HIPAA guidelines. So the Department of Health and Human Services has a whole website dedicated to HIPAA. I will be the first to tell you it's overwhelming. It is overwhelming. So here's what I recommend. HIPAA is not just about privacy. A lot of people associate HIPAA with privacy. HIPAA has 5 titles. The title that is related to the work we do, and now I'm drawing a blank, I think it's Title 2, the Administrative Simplification. And there are HIPAA privacy guidelines, there are HIPAA security guidelines. And for both of those, they have a summary, if you will, of the regulations. I would download those, read them through once, and then go watch a video. I'm not going to tell you to read them 3 times because you are going to get through the first time and say, whoo, I'm not going back. This is important because when you take out that review book and you start to review some of the questions, you need to have the reference that backs up that information, okay? Privacy and security are huge components of the coder's work. All right, so I guess I'm going backwards now, right? Task 3, recognize patient safety indicators and hospital-acquired conditions. So patient safety indicators, there's an organization that provides great information on what patient safety indicators are. What are the indicators for this current time span? And then when it comes to hospital-acquired conditions, I want to give you a connection. Remember in domain maybe 1, we talked about present on admission indicators. Well, here's the deal. Hospital-acquired conditions are the conditions that were acquired at the hospital. So they weren't POA. I want you to really take some time and think about the domains individually and collectively. They go together. When you take your CCS exam, you're not going to know, oh, this is domain 1. Oh, this is domain 2. Oh, this is domain 1. The questions are going to be fired at you. My understanding, you cannot mark the question and come back. You got to answer it right then and there. So don't waste your money paying for the test if you're not going to shift your mindset to prepare for the test and prepare for the day after the test, the days after the test, the real world. All right, apply payer-specific guidelines. So this is one that I often struggle with in terms of explaining. In my mind, and I highly recommend that you look in the CCS exam prep book, that the payer that they're talking about is Medicare. But I think it's just beneficial, on general principle, just to understand the different payers. But I would not spend a lot of time becoming an expert on billing payers. Why? This is not a billing exam. Henceforth, the reason why coding and billing are different. And then last and certainly not least, task number 1, ensuring the integrity of health records. HIPAA has an article that talks about high quality documentation. And I think that is just so important. It's definitely something that is in my heart. I really believe that as a patient, the documentation should be quality. Most organizations have health record policies in place. And as a consultant, my role is to help support them in that endeavor. Well, it has been a pleasure providing you with this little mini review for the CCS exam. May the force be with you.